Record. All right, welcome out everybody. Today is November 18th, and this is the Viewfinder Low Vision informational webinar for November. We're talking today about guide dogs, and we have with us Leslie Hoskins from the Leader Dogs for the Blind. So we're grateful to have you with us, Leslie. Again, a little reminder for everyone, the informational webinar we do once a month. This is an opportunity for us to talk about different topics and just educate the public on what's available to them in regards to low vision and visually impaired services. Viewfinder Low Vision is an optometry clinic. We do exclusively low vision care here. So we have all kinds of devices and instruments and things like that that we use to help with low vision. So if you haven't come in to see us, we'd love to see you. If you have, then just enjoy the education here. Anybody who comes in live with us, we always ask to mute, and we'll take questions towards the end. We're going to turn the time over for Leslie to talk a little bit about herself and about Leader Dogs for the Blind.
Thank you. I'm excited to be here. Let's go ahead and share my screen and we'll get started. All right. So my name is Leslie Hoskins. I am the Outreach Services and Community Engagement Manager at Leader Dogs for the Blind. I'm also a certified orientation and mobility specialist, and that is someone that teaches people who are blind or visually impaired to travel with the long white cane. So we'll go ahead and get started. Leader Dogs for the Blind is a nonprofit organization located in Rochester Hills, Michigan. We were established in 1939, and we work every day towards our mission of empowering people who are blind or visually impaired with lifelong skills for safe and independent daily travel. And on the screen here, I do have our mission typed out with the Leader Dog logo at the bottom. A couple things to know about Leader Dog is that we do not receive any federal or state funding, and we receive no payments from insurance companies. So Leader Dog relies on voluntary contributions to fulfill our mission. All of the services provided by Leader Dogs for the Blind are completely free to clients, and that does include room, board, and airfare. So we will actually fly clients up from Arizona, pick them up at the airport, and bring them to our facilities to stay. When staying on our campus, it's kind of like staying in a hotel. Clients would have their own room, their own bathroom. We supply all the linens, towels, sheets, all that good stuff, and clients would be bringing their own clothing and toiletry items. We support our mission by offering three different programs, or three main programs that we really focus on, including our guide dog training, which is of course the one we're most known for. We also have our orientation and mobility program and our summer experience camp for teens. So on the screen here, I do have the three program icons, the guide dog icon being a guide dog in harness, kind of in a circle, or the outline of a guide dog in harness inside a circle. For the O&M program, it's a stick figure, kind of using a long white cane inside a circle. And then for the camp, there's a tent inside of a circle. So just a couple of things to know about Leader Dog that makes us a little different than some of like state agencies or different organizations. Leader Dogs for the Blind does not require any vocational goals. So clients who are coming to us for services do not have to have a vocational goal in order to qualify for services. There is no upper age limit or age restrictions at Leader Dog. Clients do have to be 16 years or older to qualify or to come to campus for any of our programs. However, we don't have any upper age limit. So we've actually served clients well into their 80s and 90s. We have no limit on number of service hours available. So we really want to teach or help clients throughout their lifespan. You know, it's not a one-time and then you're done. Clients can come back for multiple weeks of O&M. Clients certainly come back for multiple guide dogs. And then there's no formal referral necessary. So one thing that's really nice about any of these programs at Leader Dog is that clients can simply go online and or call and start an application. So you don't need to have any really doctor's note or prescription. You don't have to have anything from a doctor, really. We do ask for information from your eye care physician and your doctor regarding the application, and we'll get to that in a little bit. But as far as any formal referrals, those are not necessary. You can simply go online at leaderdog.org to start an application. And on the screen, I do just have those bullets listed. So let's talk about the program we're most known for, and this is the guide dog training. On the screen here, I have a picture of a woman and she's sitting down, she's kind of hugging a black lab leader dog, and he's looking at the camera quite sternly. He takes his job seriously, and the woman has a big smile on her face. So again, this is the program we're most known for. And then this is when clients are specifically matched by our guide dog mobility instructors with a guide dog to fit their needs. So some of the things that are taken into consideration would be a client's pace, how fast they walk. We want to make sure that we find a dog that matches that same natural pace. We don't want clients to feel like they have to keep up with the dog or that the dog is slowing them down. So finding that right natural pace. We're also looking to see what type of travel environment our clients are traveling in. Is it a big city? Is it more rural? Is it, in a classroom or a school all day? What are those environments? We want to pick a dog that's going to excel and thrive in those types of environments. Dogs are kind of like people in that way. They have places they prefer and places they don't prefer. So we want to make sure, again, that that's a good fit. Our guide dog mobility instructors really, when making this matching process, it is so unique and there's so much that goes into it. Our guide dog mobility instructors complete a 3-year apprenticeship to learn as much as they possibly can, not only about dogs and training dogs, but also about the people and how to make that connection and how to teach individuals to work with guide dogs. So we're going to go ahead and I'll talk about the different training options in which we offer our guide dog training. So on the screen here, I have listed out the 4 different training formats. So Leader Dog really recognizes that it's not a one size fits all. People like to receive instruction and training in different formats. People also have different commitments and things going on in their lives. So we want to make sure that we're trying to fit everybody's needs. The first option that we have, and probably our most common, is the on-campus residential program. This is when a client would come and stay with us on campus for typically 3 weeks, which is a long time. An advantage of this, though, is that they're away from home distractions. So you don't have to worry about maybe the kids running around or kind of making dinner, getting all those things ready. It's when you're on campus, you're really just focusing on yourself and your dog and kind of bonding and learning how to work together. Another benefit would be that you have the support of your peers. People are there going through the same thing, experiencing the same thing, and it's nice to be able to have somebody to relate to. Additionally, you have the support of the on-staff orientation and mobility specialist. So if you should have any problems with orientation or mobility or really anything like that, you have the comms there to assist with that. And then, of course, I always have to mention that the food is delicious. So if you're coming to stay on campus, you will not go hungry. There's plenty to eat and they are always feeding you. The second option is our in-home delivery. This is going to be really great for somebody who can't leave home for 3 weeks. 3 weeks is a really long time to be away from home, whether you have family obligations, work obligations, or health concerns in which you can't be away from home for an extended period of time. So for this, our guide dog mobility instructors would actually bring a dog to the client's home environment and work one-on-one with them for around 10 days. Some benefits of this program would be that you're working on your own specific routes in your own specific environment. You are going to your grocery store. You're patterning your dog to the actual places you're going to be traveling. It's also that one-on-one time with the guide dog mobility instructor. Our third option listed on the screen here is our Flex program. Our Flex program is really a combination of that on-campus and in-home delivery. So again, if a client can't come to campus for that 3 weeks time, but maybe they can come for a week or 2 and then receive some follow-up support in their home area. So again, kind of the best of both worlds there with a Flex program. Lastly, we have our deaf blind program. This is specifically for individuals who are both blind and deaf or hard of hearing. And during this program, typically our clients communicate with American Sign Language, whether that be visual or tactile. It really depends on the client's individual needs. So those are the 4 programs or the 4 training options in which we're offering our guide dog training. Keep in mind when applying for any one of these, you simply can check the box, whether applying online or with the paper application. And then once approved for a guide dog, it'll really be a great conversation between you, and the guide dog mobility instructor to determine which format is going to be best for you. But you can definitely select your preference and they'll take that into consideration and then weigh out the pros and cons of each one of those training options with you. So these programs are offered to individuals who are 16 years or older, legally blind, and have good independent travel skills to be successful with a guide dog. So I want to break that down a little bit further. What does that mean to have good independent travel skills to be successful with a guide dog? There's a lot of myths out there about, get a guide dog, it'll fix everything. You just need a dog. And unfortunately, that's not the case. The clients do have to have quite a bit of skills in order to be accepted for a guide dog and really successful with a guide dog. So listed on the screen here, it says IGDF standards. What that means is the International Guide Dog Federation standards. And this is the industry elected body responsible for the development, monitoring, and evaluation of the standards applied within all IGDF member organizations. Basically, what that means is that they're the accrediting body, basically, that holds us accountable for training high quality guides and providing excellent instruction. So there's not a lot of state and federal regulations right now for service animals. And so this is kind of that certifying body that comes in and they really make sure we're doing what we're saying we're doing, basically. So they come in once every 5 years and they check everything about Leader Dog. They go through all of our files, they go through our facilities, they check our training, our records. I mean, you name it, they're looking at it to make sure we're putting out quality guides. So number one takeaway here is that when researching guide dog organizations, because you should totally research your guide dog organization, we all have things that we excel at and different strengths, and there's lots of reasons to go to different ones. But the number one thing you want to do is you make sure you go to an organization that is accredited through the IGDF. Because that means somebody is holding them accountable and that they're doing what they're saying they're doing. And there's plenty of IGDF accredited organizations within the US. But these are their list of standards. So when an applicant applies for a guide dog, these are the things that we're looking for to see that they've met in order to be approved for a guide dog. So it's kind of like a checklist for that admissions committee as they're reviewing an applicant file. So I'll go through this rather quickly. And if anybody has any questions, we can certainly go over them, or I'm always happy to discuss later too. But the first one is motivation. Motivation to train and work with a guide dog team in the long term. On average, our guide dogs work anywhere from 6 to 10 years. And that's a really long time. That's a big commitment. So making sure that when you're taking on a guide dog or interested in a guide dog, you're prepared for that long-term commitment. And that's usually just their working years. Many times they live to be much longer. The second thing is leadership role, the ability to achieve and maintain the leadership role in the person guide dog relationship. I know a lot of pets that get away with a lot of things, including my very own little dog here sitting at my feet who runs this household. And it's a little different with the guide dog. They have certain rules and standards that you have to maintain. For example, it's really easy to let your dogs get on the couch and furniture, right? Well, that's fine until your guide dogs are doing that. And then all of a sudden you're at the doctor's office and they have a couch in the lobby and your dog jumps on the couch. I mean, how embarrassing would that be? So making sure that we're holding those standards and rules and the dog knows what to do and when. Physical ability to manage a large breed guide dog. Guide dogs are around 45 to 85 pounds, which is quite large. And every now and then they remember that they're a dog and they have these dog instincts and they might want to lunge after a squirrel and think this is their chance. So really being able to physically hold on to the dog, if they should do that, hopefully they won't, but if they should. Next up, which I'm going to say is the most important, is functional orientation to the routes and destinations that the person will use. So this means consistent orientation with no assistance, problem-solving skills, and the ability to reorient self with minimal to no assistance. Basically knowing where you are, where you're going, and how you're going to get there at all times. When traveling with a guide dog, it's up to the handler to determine where you're going. So guide dogs are taught to travel curb to curb. And so at each curb, they're looking to you to make that next decision of whether you're going straight and crossing the street or whether you're going to turn left and right. That is up to you as the handler to make those decisions. The next item here is sufficient work. So as mentioned, these dogs, have a lot of really important skills, and it's important to maintain them. So we ask that our clients have a minimum of 3 established routes that are regularly traveled without assistance. And we ideally want purposeful routes, something to motivate you, something, to the grocery store or to the coffee shop, to the bank, places you need to go. Routes around the neighborhood are great too, but it's good when there's a little bit of a motivator behind those routes, that you're going to get out, even in the rain sometimes, to get out and do these routes and keep up those skills. Next on the list is vision loss that causes the person to be dependent on a primary mobility aid. So for each guide dog organization, that might vary slightly, but for us at Leader Dog, that simply means that clients meet federally regulated legal blindness standards. For other organizations, some require more vision loss, but for us at Leader Dog, that strictly means that you are legally blind. Next, we've got independently able to cross streets. So again, dogs don't actually know when it's safe to cross the street. That's totally up to the handler to determine. So we do expect our clients to be able to walk up to an intersection, analyze how it's controlled. Is it a stop sign? Is it a light intersection? And then determine the best time to cross with the least amount of risk. And then you, as the handler or the client, is giving the command of forward and telling the dog when to go. And the last two are positive home environment and financially responsible. It's important that the dog's going back to a really positive and happy home where everybody's on board with this choice. And so that the dog can live, of course, a happy life. And then financially responsible. On average, we say that guide dogs cost about $1,000 a year, and that's on the minimum to just maintain those food, vet bills, the flea and tick medication, all of the vaccines and things like that. So keeping in mind the financial responsibility. While all of the programs are free, there is no like one-time expense for the guide dog or anything like that. Clients are expected to maintain the financial needs of the dog after training, basically. So that's the guide dog training. And I'll come back to in a little bit here. We'll talk about kind of the life cycle of a guide dog and the whole phases of that. But I want to switch gears now and talk about our orientation and mobility program. So on the screen here is kind of a front view of a young female walking with a long white cane, and she's on a sidewalk in a residential area. And behind her is another female who is her O&M instructor. So in January of 2002, Leader Dog started our very own orientation and mobility program to help clients increase skills and meet their goals of traveling independently, whether that's with a guide dog or a cane. So a really nice thing about this program is clients do not have to be interested in a guide dog in order to attend our O&M program. If clients are just starting out, newly blind, they're even just trying to figure out, is now a good time to start using a cane? Where do I begin? This is a great program for them. We want to focus on traveling independently. Again, whether guide dog or cane, it's totally up to the client. There's never any pressure to get a guide dog. The O&M program's a little different than the guide dog in that it's only 1 week long. So typically clients would fly in on a Sunday. We'd meet a Monday morning, work together Monday through Friday, and then they would depart on Saturday morning. Monday through Friday, that client's going to be working one-on-one with a certified orientation and mobility specialist, and typically end up receiving between 25 and 30 hours of direct instruction. So it's a week that's completely individualized, and training takes place in numerous environments based on what the client's goals are and what the client's needs are. So different from the guide dog program too, this is available to anyone. There's no skill requirements because that's what we plan to work on during the week. So clients don't have to know how to cross streets. They don't have to know any orientation skills of where they are, where they're going, because that's what we're going to work on. This program is also available to individuals who are 16 years or older and legally blind. However, I will say there are some minor exceptions with that. So if you do have clients that are like on the verge or have that kind of progressive diagnosis for the O&M program, we do have some flexibility there. So it's always a good idea to kind of call and walk through that, as it may still be an option for them. And again, this program is free, including airfare. So we've kind of broken up the O&M program as well into a couple of different training formats, which I have listed on the screen here. Ultimately, I want to be clear that the week ends up being really completely individualized for the client and maybe a combination of these. But the reason we kind of created these categories is one, it helps clients understand what type of training we can provide. And two, it helps us as instructors recognize kind of what their goals are for the week. What do they want to get out of the week? So the first one we have is Introduction to O&M. This is great for somebody who's really just starting out and has maybe had little to no training. We're going to give all of our clients who come to the O&M program a free cane. We're going to size them up, get them the right cane, and start working. If clients prefer to bring their own cane, that's okay too. We have no judgments. Whatever type of cane anybody wants to use, they're welcome to do so. But we do give everyone a free cane. We also try out different cane tips so that they can understand and use what they're going to like. So Introduction to O&M, great for somebody who's really just starting out. We're going to start at the basics of opening and folding a cane, basic cane technique, going through a door, getting in a car, stairs, really just small, and gradually builds. The next option is O&M brush up. This is good for somebody who's maybe had some formal training in the past, but things change. Vision continues to change. Technology continues to change. The environment continues to change. Roundabouts are a real thing happening right now, and makes travel really difficult. It's also a really good option for those individuals who've maybe been traveling with a guide dog for a long time and are going to have to be using their cane while maybe they wait for a replacement dog, or their dog's retiring and things like that. Our third option is O&M for guide dog readiness. This would definitely be the program for somebody who is interested in a guide dog. We're definitely going to go through those International Guide Dog Federation standards, talk about realistic expectations of a guide dog, and talk about what skills in order to be approved for a guide dog. And then lastly, we have what we're calling our advanced O&M, and that's really for independent cane travelers who are just looking to take their skills to that next level. Maybe they want to incorporate some technology into their travel. Maybe it's somebody who's traveling and analyzing really complex intersections all the time, really just, again, kind of upping it just slightly. So those are the programs that we're offering. Again, it really ends up being unique. We want to meet clients wherever they're at skill-wise and then continue to serve them throughout their lifespan. So we're here, if a client comes in for an introduction week of O&M and then maybe 5 years later, they have a huge vision fluctuation or something changes and they move and they might need a new way of traveling, some new tips and tricks, and we are here for that. So I'll talk briefly about our summer experience camp. On the screen here, I have a picture of our last in-person camp, which was like 2 years ago. And it's about 20 campers and half of them are standing and half of them are kind of kneeling in the front. They've got their canes out and they're sitting underneath a big tree on a grassy ground. We're at a campus, actually, our university. But our summer experience camp is a week-long camp for 16 and 17-year-olds who are legally blind and come from all over the US and Canada. We do a lot of fun stuff. We focus on leadership skills, talk about mobility options such as a guide dog, accessible GPS, but honestly, the most important thing that we get out of this camp is that the campers are making friendships and building memories to last a lifetime. I think the nicest thing that the campers get out of this is usually a connection, a friend, somebody they can pick up the phone and call and say, today sucked, and the person on the other end is going to understand and say tomorrow is going to be better. And that's really what happens during this week. Of course, we play beat kickball, we go rock wall climbing, zip lining, we spend a full day with a guide dog. And the best part about it is at the end of the week, they're all, sobbing and hugging because they don't want to leave and they just made such good friends. So it's really nice to talk to campers years later and hear that they're still in communication with 5 other kids and they, Facebook and Snapchat or whatever is cool these days. And they keep in contact, which is really nice. So, anybody who's 16 or 17 who could benefit from this camp, it's going to be held June 26th through July 2nd. And I highly recommend it. It's just so much fun. It is exhausting, but it's the most fun. This is a new program we have coming. This is called Tom Talks. And on the screen, I have the icon, the Time Talks or logo. And it says Tom Talks with the O being kind of like a chat bubble almost. It stands for Technology, Orientation, and Mobility. This is a virtual program for participants ages 18 to 24 years old in the US and Canada, and will be taking place in January. This is going to be our 2nd year doing it. And it's a lot of fun, but it's also just really good conversation. So kind of that next maturity level after camp, the 18 to 24-year-olds, not a lot of services are available for this age group. It's a good opportunity to network, make connections, talk about independent travel, professional readiness, things like when to disclose a disability when applying for a job or school or program and things like that. We do a mentor panel with some other professionals who have kind of gone through it, right? And they can share their experiences. There's a Q&A session with the guide dog mobility instructors and O&Ms. Last year, we had such great success and just really good, deep conversations and connections were made. And we're really excited to do this again. The application is online at our website right now at leaderdog.org, and the application is due December 3rd, which at this point is tomorrow, and I can't believe it. It's going by so fast. So that is Tom Jocks. Our next virtual program that we're offering is a virtual summer experience camp. So as mentioned, we weren't able to have our in-person camp the last 2 years, which was really quite sad for us. But a really positive thing that came out of it was this virtual summer experience camp. And we had so much fun with it and such a good time that we're planning to continue it. This camp is for 14 to 17-year-olds. So because they're not coming to campus, we're able to open up that age group to a younger audience. We still talk about a lot of the same things, leadership skills, mobility options, such as the guide dog, and again, making connections. So the campers get to meet other teens kind of going through the same things. We know so many of our teens out there don't know anybody else usually who's blind, let alone another teen that is blind. So to kind of have somebody to call and again, just make those connections is really great. We did send a fun box ahead of time and did a trivia night and scavenger hunt and just really fun stuff. So even though it was only 2 hours a day and on Zoom, it still was exhausting. I mean, the kids just really brought this camp energy and we had so much fun, but it's amazing compared to the 80 hours that we would put in a normal week. We were still tired. So virtual camp is happening June 20th through the 24th, and it's a really fun opportunity. On the screen here is a almost like a snapshot of a Zoom meeting with 4 of our O&M instructors, 3 of them female and 1 male, and there's kind of 1 photo in each quadrant. And last thing I'll talk about virtual, I promise, is our virtual learning resources. And this is available on our website under the resources tab. There's a drop-down menu with virtual learning. And here you're just going to find some really good resources. So if somebody is thinking about coming to Leader Dog for training or trying one of our programs, this is a great place to start. We've broken it up into 4 different audiences. The first one being prospective clients, second one being specific to our graduates, the third one, family and friends, kind of that support network, and then the 4th one being blind rehab professionals in the field. And under each one of those categories, you're going to find resources unique to them. So for example, the prospective clients, you're going to find a great guide dog readiness video, for somebody who's thinking about a guide dog, kind of going through the things that we've already discussed a little bit. There's also going to be client testimonials, hearing firsthand from some of our clients who have gone through our programs. There's a campus tour. There's a video on how to know when to start using a cane. That's a big question we get all the time, that clients think if they have some remaining vision that they don't qualify or that they're faking it if they're using a cane. So really understanding that legally blind doesn't mean you don't have any vision at all. Most of our clients, in fact, have some remaining vision. So kind of breaking down some of those myths and things like that. So it's a great resource. By all means, please do check it out, share it with anybody. It's available. And on the screen here is a screenshot of that web page, and there's 4 different pictures representing each one of those categories. So just to touch on our application process, sometimes this can feel a little daunting. There are a lot of parts and pieces, but when you break it down, it's not too bad. And most of it's kind of just handing the paperwork actually to your doctor, so they get to do all the fun stuff. But to apply for any of the programs, you can simply go to leaderdog.org and apply online, or you can call at 888-777-5332, and we're happy to start an application over the phone or mail you an application or email you an application, really however your preferred format is. A couple of things to think about are some program requirements that kind of go across the board here for all of our Leader Dog programs. The first one I have listed is 16 years or older. So in order to attend any leader dog program, you must be 16 years or older to come on our campus, basically. The second one being legally blind. And next to it in parentheses, it says minor exceptions. And that again is for that O&M program. Because we don't receive any state or federal funding, we do have some flexibility on who we can serve. And it's actually a really big topic right now about functional vision and travel. So that is something we're really looking into specifically for our guide dog program. But as of right now, must be legally blind for a guide dog. But for our O&M, definitely worth a phone call to kind of have those conversations. Most likely we can assist in some way. Next that we have listed is able to administer our own medications and self-care skills. This one's really important. We actually don't have on-staff medical personnel. And so it's important that clients be able to manage and administer their own medications, their own eye drops, anything like that they would have, they need to be able to do themselves, as well as just daily living skills. So keeping in mind, they're basically staying, or clients are basically staying in a hotel by themselves, or like a dormitory, I guess, if you want to think of it that way. So kind of all those, managing clothes and laundry and showering, all of those types of skills in order to stay independently. I will say we do always have 24-hour resident assistants on property. So if there's, something, they can always assist with that. Like sometimes if you drop a bottle of pills, right, that's crazy. How are you going to find all those? So we're there to assist in those types of situations, of course. We also have 6 months seizure-free or fainting spell-free, and then able to walk 30 minutes sustained multiple times a day. So it's important that our clients be able to walk and multiple times because we're busy. We're out there traveling. And as far as the actual application packet, the first thing is the application, which is that generic information of date of birth, address, guide dog preference, things like that. We have a medical packet that consists of medical history, physical examination, and a medication form. We ask you to hand that to your doctor, and then your doctor send it back to us. We also ask for a vision evaluation from your eye care professional. That's mostly to mark off legal blindness for the guide dog program, but it does help to give us an idea if there is any remaining vision, how a client might use that to their advantage and how we might use it during training. We also ask for an O&M evaluation if a client is seeking O&M or if they've had some O&M in the last couple of years. It gives us a starting point as to where they're working from or confirms their skills for a guide dog. We have a mental health evaluation for anybody who's seeking mental health from a provider. And it's a really just short document. We just want to make sure clients are going to be safe when they're away from home for an extended period of time. We also have release forms and waivers. We ask for personal references. That's actually a really important one. When you think about coming to campus, you're coming here with people from all over the US and Canada from different cultures and different backgrounds. And we really want to make sure that everybody's going to be respectful and courteous of one another. And sometimes tensions are high and stressful, when you're learning new things. So just making sure everybody's going to be nice and respectful. And then a video. Video is kind of the biggest piece. And mostly for a guide dog, because again, we're getting all that information to make that matching process happen. So we want to know your travel environment, how fast you're walking, all of those really good things. We provide a very descriptive document on what we're looking for that. And I will briefly go through the life cycle of a leader dog, because this is always one of those things that is the most interesting to people. But on the screen here, I kind of have like the 7 phases or stages of the life cycle of a leader dog, and they're in a circle, and then there's arrows kind of pointing from 1, 2, 3, 4, and so forth, and they're going in a clockwise direction. So we'll go ahead and start. So first up, we actually have our very own breeding department who decides which dogs to breed together to help produce dogs that are healthy and have the personality and responsibility needed to be a guide dog. So our breeding department kind of has, we have our host dogs, our host families who host our breeding stock dogs, and they're volunteers. So we have them that live within an hour radius of leader dog, and our breeding dogs all live in these host families. And then they come in when it's their time to breed, and then they go back home. And ideally, the puppies are actually born in host family homes, and they spend the first 8 weeks there. So we're so lucky to have all of these volunteers who host these dogs and actually have all these little puppies in their house for 8 weeks while they're whelping with their mom. And then they bring them back into campus. So at this point, they'll return to campus and they'll go through a quick medical evaluation before being assigned to their puppy raiser. Puppy raiser is also a volunteer who spends the first year of their life with them, and they have the honor of naming the puppy. They also get to teach the dog house manners and house rules, so the potty training and appropriate behavior. They're also taking the dog and exposing them to as many environments as possible. So it's really important to these dogs that they know how to act and what's appropriate in different environments, such as parks, restaurants, festivals, airplanes, you name it. So they kind of spend that whole first year together. Around their birthday or a little after, they typically get a happy birthday card with dates of when they need to be returned. So at that point, the puppy raiser will bring the dog back to campus. They'll go through a very intense medical evaluation. And at this point, a couple things could happen. One, they could be career change for any sort of medical concern or issue. Even simple things as hip dysplasia or chronic ear infections. Sometimes that will add an added expense to our clients, and we don't want to do that. So even if they're a really great dog, if it's going to be a constant medication, they will be career changed. And another option is they be pulled for breeding. Maybe they're the perfect specimen of health and temperament and well-being, and we're going to pull them into our breeding department. And the third option is that they're going to go into formal training. At this point, they would be spayed and neutered and start that formal training. So on the screen here, I do have a cute picture of a little black lab puppy wearing a future leader dog bandana that says Duke. There is a little golden retriever puppy, kind of a close-up laying in grass, and he's got his tongue sticking out. And then there is a picture of 4 gentlemen kind of like squatting down or kneeling down next to 2 different dogs. And that is actually a picture from our puppy raising prison program. I can't remember all those P's in what order they go, but we actually work with other prisons and have a puppy raising program within the prisons. And it's been really rewarding on both ends. The dogs really like the structure and the routine, and the prisoners seem to really relate to kind of having some sort of responsibility, something to look after, and that kind of unconditional love. So it's a real win-win. So now the dog's back, they're starting formal training. This is a 4-month-long process with our guide dog mobility instructors. These guide dog mobility instructors are highly specialized. They go through a 3-year apprenticeship to learn all the things about dogs. It's really important. We do only use our own dogs. We don't recommend anybody train their own personal dog to become a guide dog. These, again, are professionals that spend a lot of time making sure the dog is going to meet these high standards. So the first month is typically starting out small, name recognition, obedience, just starting to put the harness on, figure out what that's all about. Second phase or second month, they're starting to stop for curbs. They're starting to guide around obstacles. Things are getting a little more intense. Phase 3, now they're going to start generalizing these skills to new environments. So they're going to be going outside of Rochester to make sure that they know to stop at curbs in Troy and not just Rochester. And then phase 4 is really kind of that really intense phase where they're starting to think about that list of approved clients and taking them to those environments. So again, if there's a client that lives on a farm, we're probably going to take the dog to see, how do they handle cows and horses? Or if a client is a teacher or has small children, we want to make sure that the dogs are going to be comfortable around those small children as well. And so it gets a little specific at this point. They're also doing public transportation. Our guide dog mobility instructors are putting on blindfolds and actually testing out the dog's skills as well. At any point in time during these 4 phases or these 4 months, dogs can be career changed. Still, again, from medical concerns, temperament, behavior. Some dogs have body sensitivity and they just do not like the feeling of that harness. And so when a dog is career changed, the first thing we try to do is actually find a different career for them. These dogs are bred to be workers, and that's what we'd like to do first. So we may work with other organizations to see if something else is going to be a good fit. If that doesn't work out, we typically will call the puppy raiser back and say, hey, so-and-so didn't make it. Are you interested in adopting them? And if they will, it's great. If not, we have a very long list of people who are waiting to adopt puppies. So they always go to good homes. But on the screen on the left, there's a picture of a female guide dog mobility instructor wearing a red polo, and she's working with a black lab in harness. In the middle is a male guide dog mobility instructor in a blue polo walking another black lab. And then the third photo is a male client walking a yellow lab, it looks like, and kind of next to him is a male instructor. All right, and the last phase of training, if you will, or the last phase of our guide dogs here is when they're matched with their client. And this is when they were going to spend those 3 weeks in class together, getting to know one another, bonding, working on that relationship. We typically say it takes about 6 months to a year for a seasoned team to become really good at traveling together. Just because it's difficult, you know, there's so much work on either end, and it's a real give and take relationship. So that's kind of that last phase, and then going back home into their new environment and their new life. So on the screen here is a picture from the front of a male client wearing a purple shirt walking a golden retriever who's quite fluffy. And then next to him is a female guide dog mobility instructor. And then the other photo is actually like an ID badge of a client. And he's sitting and kind of has his arms wrapped around a black lab, and they're both looking at the camera. So that is it as far as the presentation goes. I know that's a lot of information, so I apologize, but happy to answer any questions.
Thank you so much for sharing all that. That's exactly what we wanted to hear today. I have some questions I prepared beforehand, but then a lot of things I was thinking about as well. One thing that you touched on that I thought was great was talking about legal blindness. And so for anyone who doesn't know that definition, most facilities will tell you that legal blindness is an acuity of 2200 or worse, or a visual field of 20 degrees or less. So to put that into context, most people see things at 20/20. Whether they're wearing glasses or not, that's kind of the standard. So 2200 would be 10 times worse than that. And then a visual field is typically from side to side about 120 degrees in a given eye, 180 or a little bit more, depending on how your eyes are set with both eyes together. So you'd imagine a field of 20 degrees would be incredibly small. That being said, there was an update in 2007. Now that eye doctors have electronic charts, and we can go between 2200 and 2100. If you cannot read a 2100 letter, you are now considered legally blind. So if you're at 2125 or 150, you can still qualify for those things. That's not as well known. That was a Social Security update. So that may not apply to all organizations. I don't know if that comes up at all for you guys or not.
You know, I actually, funny enough, just read that like 2 days ago. I was looking up different statistics or something, and I just saw that. And I've actually been meaning to bring that up. I will have to ask about that because we usually say the 20/200, but I did just read that. So I'm going to have to inquire.
Most state departments, even most eye doctors would tell you the same thing. Just because I'm, steeped in low vision, that's something I've dove into quite a bit. And so when we do our low vision, our legal blindness certificates, that's part of what's on there, is that this is the actual definition for it, and this is why you're getting the certificate. So for those who didn't know, now you know. So that's the big requirement to get in. Is there any kind of a fiscal qualification? Do we talk at all about patient finances or client finances at all?
Nope, not at all. It doesn't matter any standards, anything like that. All programs and services are completely free, and we don't ever ask for that information.
I think that's a wonderful thing. I want to reiterate as well, no vocational goals. So a lot of the patients we work with are coming through vocational rehabilitation, trying to keep a job, get a job. And definitely these are some of the most motivated people, but you don't have to be trying to get a job to be motivated or to be independent or to want to use a guide dog. So I really like the idea of having 3 purposeful routes. One of the questions that I had wanted to ask you about was, there's lots of different walks of life that people are going to come from, different professions and living situations. Are there any environments or situations where you would tell your handlers it's probably better to avoid these situations or avoid taking a guide dog to this kind of environment?
Yeah, that's really specific to the client and their dog too. So once you get to know your dog and where they excel or where they really don't, things to think about, of course, are like ICU units at a hospital, probably not a great idea or not even allowed. But other than that, mostly it's going to be thinking about religious beliefs. So
Okay.
traveling to different countries or going into different churches or things like that, how well they'll be received. And then like loud events, concerts or things like that sometimes aren't the best environment, especially thinking festivals where there's lots of food or things kind of on the ground that dogs have access to, not to mention just the really intense, loud atmosphere. So there are definitely situations where it's probably not the best idea to take a dog. But of course, the handler and knows their dog the best, and they can always call and talk through that with a guide dog mobility instructor too if they're questioning anything.
Speaking of, different environments and situations, so in Arizona, hiking is a huge thing. There's lots of different trails to go on, lots of different mountains, things like that. And I'm sure there is in Michigan as well, but ours never gets covered by snow, just scorpions and rattlesnakes.
Oh gosh, I can't even imagine.
So, do people ever take guide dogs to outdoor adventures?
Yeah, definitely. Our dogs go hiking a lot. That's one of our clients' favorite pastimes. So they definitely do go hiking. We have some great photos of clients working with dogs hiking. It depends too on your dog and you if you use the dog in harness while hiking. So you're actually using the dog to guide you, or sometimes people do just take the dog and have like on leash. So they're not necessarily responsible for guiding at that time. Again, that's up to the handler and the dog together, kind of making those decisions and those calls. But yeah, they definitely go hiking.
So, in regards to orientation and mobility, you mentioned, different kinds of cane tips, and there are different lengths of canes and kinds of canes, and add-ons you can do to it like sonar and things like that. How often is a client using both a cane and a guide dog at the same time?
So typically they wouldn't I'll say usually because there's a circumstance for everything, but most of the time you're either using one or the other. So if you have your guide dog out and you're working your guide dog, you're holding onto the harness, then you would have your cane put away. However, there are times, because we do encourage our clients to have their canes with them at all times in case they need that tactile information. There are times where you would drop the harness and hold on to just the leash of the dog, which again symbolizes to the dog that they're not responsible for guiding at that time, and would get out a leash. Or get out a leash, get out a cane to kind of check the tactile information, and then maybe put the cane away and go back to the guide dog. So typically it's one or the other.
Now, I was reading online on your website, though, that you do advise using GPS, and you mentioned, self-orientation, knowing where you're going, the handler's responsible for that, and you guys will use the HumanWare Victor Trek, right? Is that
Mhm.
right?
Yep, Victor
Which
Reader Track.
we don't have that product in our store. We haven't had enough people who wanted to get it, but I have read up on that. Is that different than using smartphone GPS?
Yes, and there's pros and cons to both. It's a big discussion. So we actually offer the GPS to all of our guide dog clients because they've already been approved, which means they already have all those orientation and mobility skills. Because it's a secondary device. We certainly don't want our clients 100% reliant on this GPS device because technology fails us. So we want to make sure that they've got the skills and orientation in order to travel with it or without it. But if given the opportunity, and then clients really have to weigh the pros and cons between a separate handheld device and their phone. A couple nice things about the separate handheld device are it doesn't require a data package, so you don't have to worry about that. The battery life lasts much longer and it's not going to drain your cell phone battery. It's a kind of that nice separate entity. There's no, like I said, no data package, no the battery doesn't, die as much. And then two, it's nice to use them in combination. So if you're looking up a location or something like that, then you can use your phone to maybe search and call and ask some questions, and then put your phone away so you don't waste the battery or data, and then use it as the secondhand device. So pros and cons. People like it, people don't like it, but it is a really nice device.
Yeah, one thing I've definitely found with smartphone GPS users is, you turn the volume up to hear the GPS, and then you'll get somewhere, forget to put the volume back down. and then you have your ringer going and things like that. And so, especially if you've turned your phone into, like a voiceover or talk to text, version where everything's read out loud, that can be another issue.
Hmm. And it's nice too to not have to be carrying, you're having your cell phone out,
Hmm.
put that in your pocket and kind of carry this more durable device, if you will.
Right, right. So the last thing I want to, you've answered kind of all my questions already, which was fantastic. Kind of the last few things I would mention, you talked about the breeding program, very, um, a lot of thought has been put into these dogs. And so definitely advising against someone just trying to take any dog that they have or a dog they've picked up at, a shelter or something like that and try to turn that into a guide dog. We want to use these dogs that have been bred and built just for this purpose. If someone gets a guide dog and a couple years down the road they feel like perhaps they need a refresher course or something like that, is there a guide dog refresher course that's available as well?
So that's really kind of a unique case to case scenario. So anytime a client is having difficulty or if something weird's happening with their guide dog or they're just feeling like they need that brush up, we encourage clients to call all the time because the guide dog mobility instructors might be able to give some over the phone support, a few training things to try to kind of maybe remotivate your dog or get them interested again. These dogs are so smart that they're doing the same route every day. They might get a little tired. They might try to look for some other ways and things like that. So the GDMIs are great at giving kind of those tips and tricks. But if it came down to that, we've absolutely brought clients and their guide dog back to campus for kind of a little refresher or brush up course. Or we can always send a field rep to go visit as well and work with them in their home area. So we support the team, the guide dog, and the client throughout their entire, time together and thereafter as well. So we really want to be kind of there for the whole lifespan of the client.
Awesome. Well, Leslie, thank you again so much for this wonderful presentation. I think what I want to leave off with is if someone wants to get in touch with Leader Dogs and talk about this opportunity or come see the facility or learn more, what's the best way for them to get in contact with you?
Absolutely. The best thing to do would be go to our website at leaderdog.org or give us a call at 888-777-5332. And we're happy to help.
All right. Thank you again so much for your time today. For everyone tuning in, our next informational webinar will be early as well because of the holidays. We're usually the last Friday of every month, but because of Thanksgiving and Christmas, we've moved everything a little bit earlier. So Christmas comes on the last Saturday of December. We'll likely be doing our presentation on the 17th of December, and we'll be talking about depression, anxiety, grief, and dealing with the psychological side of low vision and vision impairment. So thanks everybody for turning out and have a wonderful weekend.